Yes, everybody needs somebody, when things are not going right. You just need that person to just say a comforting word to you and for them to share and help you through that difficult time. So, as I said earlier, we are going to be having a conversation with Dr. Seshni, who is a consultant psychiatrist, specializes in autism and learning disabilities. And so she's going to, we're going to have a general conversation about what is borderline borderline personality. Welcome, Dr. Seshni.
Good evening, Valma, and thank you for having me on your show. Always a pleasure to be sharing some wisdom and raising awareness about mental health, and especially about such an important topic as, borderline personality disorder, emotionally unstable personality disorder.
Thank you for taking the time to be with us and educating the community, because at the end of the day, what the purpose of having this conversation is to enable individuals who suffer from this particular condition to have a better understanding, but also for family members and carers to understand the best way to identify triggers or deterioration in that person's health, but what's the fundamental things that we need to know in order to help that person to have a quality of life. So can you just describe what is borderline personality?
Yes, sure. I mean, as I said, it's really important, and I'm glad, as you said, we need to talk about it so communities, people, loved ones, family and friends will know more about borderline personality disorder, which is quite complex, difficult. If someone has it, it's quite challenging for them themselves and also quite challenging for their families and loved ones. So if they can understand more about it, what treatments are available, what are the symptoms and signs, they will be able to help them. So it's really important. So personality, as we know, Valma, usually by the age of 17, 18, we usually form our personalities. However, people with emotionally unstable personality or borderline personality disorder, these people, personality disorders are characterized by a few main features, such as they might have difficulty in relationships, sustaining relationships. They have difficulty in the emotional regulation, so they might resort to self-harming behavior. They can sometimes also have that feeling of abandonment and rejection. When they have any difficult situations, they can resort to having difficulties in managing their frustration tolerance, and some of them might lash out or have some anger issues. So these are the main sort of features. The more serious features which we see is that they can resort to self-harm behavior. So they have ongoing fleeting suicidal thoughts. Unfortunately, some of them do act upon them successfully, and we do lose some borderline patients, to suicide or successful suicide, which is quite unfortunate. But majority of them usually just have fleeting suicidal thoughts, so they might self-harm by cutting themselves, taking overdoses.
Can we go back to how it begins? Is it hereditary? Is it genetic? Is it something that manifests itself because of trauma? How does it begin?
Well, it's all of those that you've just mentioned, Valma. You seem to have a lot of knowledge about this already. So it's difficult to actually pinpoint one particular cause or etiology for borderline personality disorder or emotionally unstable personality disorder. But it could be each of those factors you've just said. It could be genetics. It could be that hereditary where it runs in the families. If there's a gene that's dominant that passes on through generations, it can be related to environmental factors. Trauma, really important. So we're looking specifically at anyone that's been abused. Commonly, lots of our patients will report sexual abuse or sexual assault or alleged sexual abuse or having memories of being abused when they're quite young, which is quite traumatic for any person. But as a result of these different factors, what happens is it affects the way people think, feel, and behave, and affects the way they manage in their day-to-day life and their relationships. So in essence, that's what personality disorder. So they'll present with difficulty in regulation their emotions, their behaviors, their suicidal thoughts, if they have any, and their mood. And what happens is they end up having difficulty just in day-to-day life. So people without emotionally unstable personality disorder or borderline personality disorder will be able to cope with the day-to-day stresses. But for any person, I do feel a lot of empathy for these people, because it's really a struggle, just day-to-day managing their lives, their finances, their relationships, their emotions, and just staying alive as well is a struggle.
Yeah.
And
what would you say that they can have chaotic lifestyle?
Yes, typically. I mean, I wouldn't want to generalize, but we know that majority, I mean, the good news is that as I've described emotionally unstable personality disorder, it can be quite challenging, and therefore others might perceive it as being chaotic. So even for them themselves, Valma, they find it quite a struggle. So, and I think that's where we see that mixture of their lives being chaotic, because they're having difficulty. Imagine, having difficulty regulating your emotions, having suicidal thoughts or behaviors and acting out on them, having difficulty in relationships, having mood fluctuations, and a lot of them also end up having comorbid mental health conditions, which we can talk about later.
So when you say comorbid mental health, can you explain that word? Because not many individuals, unless they're in the medical field, will understand that. What do you mean by comorbid?
Yes, so comorbid conditions mean that a person might have one diagnosis. For example, they might be diagnosed with a personality disorder, and in addition to that, they might have a second diagnosis or a third diagnosis. So it could be that they might have maybe depression in addition with the emotionally unstable personality disorder, or psychosis, OCD, anxiety, addiction disorders. So it could be eating disorders. So a lot of the times we do find that if a person has personality disorder or emotionally personality disorder, they do have other underlying conditions, because as I explained about the mood.
Yeah, it's like having a dual diagnosis, having two mental health conditions at the same time.
Exactly. So it's either two diagnoses, which is dual diagnosis, it could be triple diagnosis, and so on.
Okay, so in terms of the signs and symptoms, what would cause a trigger in deterioration in their mental health?
So it could be anything, really. So when people, as I explained, a person with borderline personality disorder, just day-to-day functioning could be quite difficult. But if it's related to the etiology in terms of the cause of their personality disorder, and if that backdates to something in relation to any abuse, so anything to do with relationships, anything to do with even sometimes intimate contact or physical contact, just even touching a person with borderline personality disorder, that can trigger it. It could be any memories that they have, sounds. So similar to PTSD, I would say, in borderline personality disorder, it could be anything in their day-to-day functioning, the environment, their interactions with other people, the struggles and challenges they face. It could be anything like that, that obviously could trigger them. So, and I think, as I said, they have difficulty in regulating their emotions. So their mood fluctuates a lot, and they have difficulty regulating it. So they might present as really down the 1 minute, and later on they'll be fine, or and later on be quite anxious and tearful. So it can change throughout the day for a person with borderline personality disorder. They also have difficulty with their frustration tolerance. So they might get into an argument, and that might trigger something that they end up lashing out on the other person, and have an anger outburst. So it can be really anything, and I think that's a really important point you raised, because identifying the triggers, knowing what borderline personality disorder, the symptoms and signs, and then being aware of what the treatments are available, like a holistic range of treatments that we have, which is not just medication, but also psychological and social therapy, psychological and talking therapies, and the social aspects of care is important. And the mainstay of treatment, I would say, medication only forms one part, but the mainstay for borderline personality disorder is actually psychological therapy or dialectical behavior therapy, DBT.
Oh, what is that? What does that involve?
Yeah.
So somebody, there's a carer out there, and they've got a relative who some of the signs you're talking about, and they have this condition. What sort of things do a carer need? But what, in terms of the therapeutic intervention you're talking about, can you explain that and what it is?
Yes, sure. So dialectical behavior therapy is the mainstay of treatment for personality disorders. There's a lot of evidence suggesting that it does provide much benefit. At least a third of our patients with emotionally unstable personality disorder, after a certain age, do end up eventually not having the diagnosis or borderline personality disorder, recovering and leading normal lives. So it's really, really a very, very good talking therapy. So if anyone's listening and they know someone that has emotionally unstable personality disorder, DBT is something to consider. So it's a talking type of therapy, but it's not just the normal CBT that we've spoken about before, Valma. So dialectical behavioral therapy is recommended by the NICE guidance, which is the National Institute of Clinical Excellence, which we follow the guidance for. And it's usually can be done individually, or it can be done in groups. And it's usually done in an inpatient setting. We do have some community settings that they do DBT, but majority of the time it's an inpatient. And it's because of the complexity of the therapy which is being delivered. And I'll try and explain it in a very, very simple way, so not much technical jargony terms. So basically, in essence, the therapy will obviously involve, as I said, single or group sessions with a trained therapist. That's really important. I've worked on a DBT ward, and it was really very impressive to see how the challenges that are faced during the DBT, but also the success that our patients do end up having when they receive the treatment successfully. But it's a long process, so it can be anything from a few weeks. So usually we ask the person to commit for a few months. So anything from 6 months, 12 months to 18 months. It usually goes on longer. I think most people end up doing at least 18 months, 12 to 18 months of this therapy.
Okay. So when you talk about talking therapy, in this particular therapeutic relationship,
yes,
is what sort of talking are they doing? Because people might be saying, well, talking about what? So what is the specific thing in that treatment that the person would get out of it, in terms of the relationship, in terms of the discussion? What would they get?
Yes. So as I mentioned, with the symptoms of borderline personality disorder, the self-harming behaviors and the emotional dysregulation, a lot of the therapy is focused on managing emotions. So they will learn to become more aware of their emotions and how they deal with the challenges and stresses. And they learn mindfulness. So mindfulness is a key component of dialectical behavioral therapy as well. So it's about emotional regulation and mindfulness. The second thing is looking at the self-harming behavior. We know that with the self-harming behavior, they will learn some skills, coping skills, how to manage when they do get distressed. So how to manage that emotional distress and how to cope with it in a more positive and a more effective way, as opposed to then hurting themselves. Because what we see with borderline personality disorder is that they end up self-harming, they end up cutting themselves, taking overdoses. So they will start to learn to manage their self-harming behaviors successfully. So when they get those urges, they will be taught strategies and coping skills. So that's second main component. The third component obviously is looking at their emotional outbursts, so the anger outbursts, and how to manage that frustration tolerance. So to teach them more healthier ways of dealing with frustrations and difficulties. So it's a very, very lengthy process, very contained environment. They will also discuss many other things which I've not mentioned because I've just focused on the key core features of dialectical behavioral therapy. So, in addition to all of this, they will learn to be able to express themselves and also to cope with those distressing. So, a lot of the times, as I said, the etiology or the cause for borderline personality disorder, if someone's been abused, sexually abused, and you can imagine, we hear about it where people have shared stories of being abused and how it's impacted on their lives. And it is quite unfortunate. That's why I said I really do have a lot of empathy and compassion for my patients with borderline personality disorder, because it must not be easy to go through what they've gone through and then to face the day-to-day challenges. But as I've said, reassuringly, if people do have the diagnosis of emotionally unstable personality disorder, and if they do receive a holistic approach of treatment of medication, psychology, and social, and if they do engage into the dialectical behavior therapy, the evidence has shown that they can recover.
Can I just interrupt there? In terms of abandonment, what would be classified as abandonment?
So abandonment is when we're in a relationship and what happens is if someone has, it could be a short-term, a long-term relationship, and suddenly the other person, wants to end the relationship. So what usually happens with borderline personality disorder, they internalize the emotions a lot, and they cannot cope with that emotional distress. And as a result, they end up feeling abandoned. A lot of the times it's related to issues that they might have experienced when they were younger. They could have been abandoned as a child, by a parent, a loved one, someone in their life that was significant, and they felt that they were abandoned. And this can then present in their adulthood and in their adult relationships. And a lot of the times it's abandonment, and it's also rejection. They do feel a lot of rejection from people around them. And I think the rejection happens and the abandonment is because of the difficulties in relationships. Like people who don't have this diagnosis can cope with normal relationships. But in borderline personality, it's much more difficult, much more challenging. And it's sort of like a self-sabotage, basically, because they cannot relate to people in the way that they should be, and other people can understand them. They end up sabotaging their relationships, and that's why they end up feeling abandoned. So if that makes sense, and rejected. So it's actually the illness that's contributing it. So if you're in a relationship with someone that's got emotionally unstable personality disorder or borderline personality disorder, I think the key thing is showing a lot of love and compassion and understanding what this diagnosis is and how it's actually contributing to that person's behaviors and emotions.
But the other question I want to ask, is it something that would be you endure for the rest of your life, or is it something that happens and once you get the right treatment and intervention, it goes away? Or is this label for the rest of your life?
The good news is that it's not a label for the rest of your life. So if anyone's listening, that there is some hope for recovery and well-being, even if you do have emotionally unstable personality disorder. I've personally seen people recover from this personality disorder. So the evidence suggests that at least a third will go on to lead normal lives. Usually between the age of 35, 40, I would say, they usually end up having episodes of borderline personality disorder or having these difficulties and challenges. And once they've undergone treatment, they have recovered and they are able to manage their emotions, able to manage the self-harming, able to manage their frustration tolerance, and any other comorbid conditions. But unfortunately, at least 2/3 can continue. So the one third will continue to have symptoms, and maybe just present with mild symptoms which they can manage. And then another third will present with symptoms which are more chronic and enduring. So it can vary from person to person. It can vary from a socioeconomic status to status. It can vary from treatment as well, which a person is receiving, and support. But as I said, it's a holistic treatment, focus on DBT, focus on educating people and loved ones around you who understand what this illness is about and how they can help you.
Okay, the other question I want to ask, which is quite fundamental. If a person has children and they are suffering from personality disorder, how will this influence their relationship with their children? Does it have an impact?
It most definitely does have an impact. And as I said, it's really difficult. Any relationships for a person with borderline personality disorder does have difficulty in relationship. So it will impact on the bonding with the person's children. You know, they will not be able to bond as a normal person would be able to do. It will impact on modeling behavior. So the child will observe, hopefully, when people are self-harming, they don't do it in front of children. We do, obviously, that's child protection issues, as you know, Valma, as a social worker. But it can cause modeling behavior. So unfortunately, the child in that family could grow up observing their parents self-harming, taking overdoses, and could model that behavior and think that's a normal behavior. It can impact on other relationships in the family, obviously, because it will impact on the wider family unit, in terms of communication, managing emotions, and challenges and relationships. So it definitely will impact, and therefore it's important that if a person has emotional unstable personality, it's identified early, the person gets treatment.
I'd like to thank you so much, Dr. Seshni Mudla, for explaining what is borderline personality disorder, what the diagnosis is, what the triggers are, and how one can develop a quality of life and help with their recovery. So thank you so much, because we're just coming up to 8:00.
Yes. No, thank you for having me.
Do stay with us. If you're out there and you want further information, we will be here. And
thank you, Valma. Just to say that the other treatment, obviously, community mental health teams, healthcare professionals, psychiatrists, psychologists, the whole team is there to support people. You can have a look at the Royal College website for any further information, www.rcpsych.ac.uk. And obviously my Facebook, Instagram, and Twitter, Dr. Seshni. Thank you so much for having me on, Valma, and have a fantastic evening.
It's a pleasure, because the more the community understands some of these mental health conditions, the more support individuals who are suffering from it can get help.
Exactly.
And also stop the crisis intervention that normally happens because the family around them, friends around them don't understand, can't identify those signs and symptoms to get that person that help. Because when you're going through that yourself, you don't think you need help.
Yeah.
And it's only when somebody says, something's not right, we need to help. So if you're a family member, a carer, a husband, a wife, a brother, a sister, a neighbor, and you can help that person to live a quality of life by just recognizing when they need help, because they don't ask for it. Nobody asks for help when they're suffering. Sometimes it's up to somebody who is observing, recognizing that they need help and support them to get that help. So thank you so much.
You're welcome. Thank you so much, Valma, as well. We need to normalize it and also get the message out there that there is help and treatment available for these people. Have a fantastic
Thank you so
evening.
much. You take care now.
Namaste. Bye.
Okay. Bye-bye.